Forward, I would like to welcome Susan Josi, Managing Director, Havas Health and USEA and ME Region, and Ms. Nitika Garg, Director Research, OPPI India, to share the insights of the over-the-counter report. A very warm welcome. Over to you, ladies.
Thank you, Kathy. Thank you so much once again to OPPI, because this report has been really waiting to be launched. And I must say that the kind of support and the championship that OPPI OTC Task Force took up to make this happen is something that I would be ever grateful for. It was a dream come true, because ours was one of the only countries which really didn't have a kind of an identification of the economic value that OTC would really mean for our country. So I have Nitika with me. What I'll do is, for the next 5 to 6 minutes, I will give you an overarching view of what the report is all about. And then I will also hand over the mic to Nitika to give her viewpoints on how she sees the implementation of this report affecting, the value of this report affecting the implementation of our policy. Is that okay, Nitika? So I'll move ahead. Yeah, okay. So just going to the next slide. What is interesting is, and this is actually a very, very interesting framework of self-care matrix, because we always see self-care in 4 layers. And this was something that was published as a paper 2 years back, where they clearly saw that, while on one side, you have the self-care activities, and like Milind rightly said, the COVID has actually made people far more aware about health. They are taking health a lot more into their hands, but they're uncertain. They're really concerned. They really don't know whether they're doing the right thing. So at the micro level, they're doing things on their own. So whether it's about eating, whether it's about their physical activities, it's there. Then some changes that they do as far as their behaviors are concerned. People are trying to live far more healthy. And within that, there are a lot of comorbid diseases where a self-care context sets in. So it's not just about doing self-care when you want to prevent, but you also are doing when you are in a comorbid situation. But last but not the least is, how is the self-care environment in our country? In any country, this matters a lot. And if you ask me, this is really the crux of what creates the ecosystem, the platform, the environment for consumers to really practice self-care. And this is actually where we have now added value by doing this study. So just to go to the next slide, what really was the importance behind the study? We have always seen that there are countries around the world who have realized the economic value of OTC. In fact, just to quote one study, which I felt was really interesting, that just moving 5% of prescription medicines to OTC resulted in a savings of almost 16 billion euros. Now, these are the kind of figures, these are the kind of numbers that we are seeing, which was done across, and people have done a number of studies in a country or even in the continent. And that brings me to the next slide to ask this very pertinent question: why should India be left behind? So if I just go to the next slide, that's the question that I'm raising, that why should we be left behind? And that's where I would like to, spend the next 4 to 5 minutes. I know it's a rush. You can see the report, but just to kind of give you a top line information on how this study was constructed, we have launched the first value of OTC study in India. And to go to the next slide, it is first of its kind. We really wanted to understand that when we say that our consumers are today in the journey of managing their ailments, and we're talking of minor ailments, we're really not talking of the major ones. What is the kind of out-of-pocket money that they're spending? Where is the journey? Where is the treatment journey? How often are they going to the doctor? What kind of expenses do they have? So just to give you an overview of how we went about the study, to the next slide. it shows that, we actually looked at those 27 common ailments which tend to witness self-medication. So we took it into all the ailments, and this is something which we have always mapped, that, there are specific disease conditions or general ailments where, consumers are self-medicating. So we mapped these 27 common ailments, and we also looked at the universe from the lens of NCCS A and B, which went across 25 towns, including the metros, Tier 1 and Tier 2. We actually went to these households. Of course, we did it through online because it was something that we had to do it during the COVID. And it was something that which moved into a space where we could move on to almost 9,000. We actually could interview around 9,797, consumers. And they were mostly housewives. In fact, from the household, it was the housewife. And if it was, about 12 years of age, they spoke on behalf of the kids, and finally got responses to the extent of around 6,700, which was plotted and extrapolated to 123 million consumers in 95 towns. And that gave us the scale and vastness. So if you see, we see them in three lenses. There are people who go to doctors when they see an ailment. There are people who self-medicate. There are people who go to pharmacists. And between all of them, they're always doing something which is like self-medication, plus doctors, plus pharmacists. So we could map this very, very clearly. Our report has captured this in greater details, but just wanted to tell you that we went into quite depth and rigor to understand the treatment journey. So what was the impact? We'll go to the next slide. So clearly self-medication to the extent of 39%, where we also looked at the pharmacist recommendation becoming part of it. But what was important and what was really key to our outcome was the significant dependence on doctors even today. And what we also felt was something that we could really put a finger on was that only 13% chose to seek pharmacist advice. We actually tend to believe that, consumers do go to pharmacists and ask pharmacists, but with all the Google that is happening, with all the plethora of information going around in the WhatsApp university, one really doesn't know how much are they relying on the pharmacist, and is the pharmacist really empowered to give information to these patients or consumers in the right manner. But the implication of this 58% dependence on HCPs, if you go to the next slide, is where the eye-opener is, because the translation of that, when you see from the way we extrapolated it, it comes to almost 35,820 crores of expenses or spends which are happening from the consumer's end, which is almost equivalent to 46 million or 47 million USD. That's the kind of money that people are spending on these minor ailments, which is a sum total of what they're spending with doctors, what they're spending with on their by self-medication, but also through the pharmacist. What is important, which you'll see in the next slide, that out of this 35,820 crores, 86%, if you can go to the next slide, it actually is translated. The contribution comes because of the money they spend through the HCPs, okay? Which only tells you, and how this kind of sums up is that there is a cost which they are paying for the doctor's consultation, for the medicines, for the diagnosis, and also for the transportation and communication. And to some extent, we also actually calculated the loss of, a day loss or a 3 days loss or a 2-day loss that they had because of the effort that they had gone to meet the doctor. So when you put all of this together, it's almost something like around 40 million USD or 30,000 crores, which is being spent just because of the reliance on doctors. And these are minor ailments, mind you. It's not really the major ones. I'm stressing this again only to tell you that it only means that the more we keep empowering our consumers, the more we do something with our pharmacists, this dependence on doctors, while we are seeing an economic value, we also know that we have a huge patient load on our doctors. The ratios of our doctors to patients is so absurdly low. And that is where we need to unlock. That is what we need to kind of release. Because if we can empower our patients, this is where our savings lies. This is where we can build a better, resilient India and who is more self-responsible. Because if you go to the next slide, a lot of the money that is spent by consumers is in ailments which they can manage. And of course, pain-related ailments take a lot of spends from the doctors. Maybe they don't know how to go about it, or even when they know about it, it's not really done in the right way. There is no great information that is accessible to them. So something is amiss here. If you deep dive into each of this, we've done that analysis, you'll find that there are reasons why patients just rush to a doctor, or possibly they don't have the confidence, or they may be not really doing it the right way. And that's what the gap lies from a policy level, from an industry level, that we can start, working on. Just to go to the next slide, just one more slide to tell you that when we did a back-end calculation on some of the ailments which today they're unnecessarily spending with doctors, you could save up to 43% from HCP spends for ailments with higher self-medication. Similarly with pharmacists, empower the pharmacist and you could get a savings of almost 37%. And this is what really are stark opportunities for us to move and see how is it possible for us to empower and engage our patients, consumers in a much more meaningful way. So this is all there in the report. The report is available. We have a lot more data points that we have worked on. But with this, I would like to hand it over to Nitika to sum up what is really the opportunity for us to unlock the potential of OTC in our country. Over to you, Nitika.
Thank you, Susan. Very good evening to all of you. As rightly mentioned by you, Susan, OTC medicines are truly a critical component in advancing these consumer health, and as they allow people to really self-treat or manage health conditions conveniently and responsibly. In our country, where cost of primary, secondary, and tertiary care is really expensive, the robust OTC policy can help bring down the cost of primary treatment by providing patients safe, effective, and easy access of such OTC products. And we truly believe that formulating an inclusion of OTC regulation will strengthen Government of India's initiative to revamp the DNC and DMRA Act. I, along with Susan and with all the stakeholders here in the industry, we are driving this whole initiative that we have a robust policy environment and the framework in this country. Through this slide, I would want to talk about what are those key enablers that can really unlock the economic value of OTC medicine in India, what Susan has explained all through. The first is empowerment. Empowering every Indian to responsibly self-medicate through clear and useful information about the right product for right ailment at the right time. Thus enhance this whole health outcomes and limit harm from misuse of abuse on medicines. And this is what I was also hearing from the previous session, that how do we limit? AMR is one such example. Engagement. OTC regulation will also increase engagement with pharmacists and evolve their role to be well-informed influencers to advocate responsible self-medication practices here in the country. Then the third enabler is encouragement. With this first of its kind, assessing the economic potential of self-medication, the pharma industry in India is really encouraged and has come together to propose the necessary revisions in classification of drugs, labeling, advertising, distribution, pricing, and the entire switch process from RX to OTC drugs. And the last but not the least is we propose that OTC legislation should encompass all the pertinent regulation necessary to govern OTC drug effectively and should be the principal law which is regulating import, manufacturing, promotion, distribution, and sale of OTC drugs. Now, the need to recognize OTC medicine as a separate category of drug in India is definitely evident and is a need of the hour. And I'm sure all the stakeholders will continue to work to have notified OTC guidelines in the country. With this, I hand it over back to you, Khyati. Khyati, please.
Thank you. Thank you so much, Susan, Josi, and Nitika Garg, for sharing these insights of the over-the-counter report. I think all of us are going to take some great takeaways from